stay and continue to practice in those areas after fulfilling their National Health Service Corps commitment. That program is also seeing a great expansion, as I mentioned, and also a fair amount of creativity in the placement, including the opportunity for sharing loan repayers between organizations and communities, such as community mental health centers, federally qualified health centers, for example, being able to split the time of a loan repayer so that we can make sure we deliver those services in an integrated fashion. I want to talk for a moment about our Health Professions Bureau and their programs in behavioral health services. They have a program in graduate psychology education training. It's a grant program. And they also have the area health education centers, which provide training and education, continuing educations for clinicians who are already in practice. And they provide a fair number of trainings around behavioral health service issues. In the Bureau of Health Professions, I'd like to highlight the National Center for Healthcare Workforce Analysis. And I think it's an important center in the collection of information and data on the current workforce. And I think that it's an opportunity for HRSA to collaborate down the road with SAMHSA in the important work that they do to collect data on the behavioral health workforce as well. We also have an important program in rural health. For example, they've produced a publication on integrating primary care and mental health services, current practices in rural community health centers, as well as the programs that they run in telehealth. And I think there's probably some work going on in telebehavioral health that would be worth knowing more about. We also have regional offices across the country, 10 regional offices, and I do want to point that out because for those of you working in different states, it's good to know that there is a HRSA presence out there regionally that you can get in touch with. And they've been working, for example, in Maine on working across the state on a behavioral health integration effort. And that was something that our regional office in Boston was part of. When we think about the Bureau of Primary Health Care, which administers the health center program, and you'll be hearing today about the kinds of examples of health centers that are partnering with behavioral health providers across the nation. This is where we want to focus a little bit of our discussion. I think they're a great example of the way in which we're trying to promote the integration of behavioral health and primary care, both with partners in the community and, when possible, within these fully integrated, comprehensive health centers. The National Association of Community Health Centers has a survey out in the field now looking at ways in which health centers are providing behavioral health centers